On the streets of Berlin, the government's new step-by-step plan met with little criticism, even some sympathy. I don't want to be in Mrs. Merkel's shoes. I couldn't do it any better. That's why I'm cautious with criticism. It's going to be step-by-step, isn't it? It's the only way to do it. I don't know what the alternative is. Opening everything up again? I think you have to do it partially, simply because the people want to see some restrictions eased. But there was also a fair amount of confusion. Critics say the careful opening strategy that Angela Merkel and state leaders agreed on is too complicated. I have to say that what's written there is pretty unclear, very confusing. It's almost as if people aren't supposed to understand what's meant to happen. Restrictions will be eased in 5 steps, each dependent on infection rates remaining below a threshold of between 50 and 100 per 100,000 people. Access to certain services will also be based on a negative corona test. To make this possible, people in Germany will get at least 1 free rapid test a week. And to boost Germany's slow-moving vaccination campaign, jabs will soon be available at many family doctors. This strategy marks a significant shift from the Chancellor's very cautious approach to the pandemic in the past.
We are at the threshold of a new phase of the pandemic. It's a phase which we can't go into carelessly, but I think it's important to say with justified hope.
The plan has already come under fire from opposition politicians.
Not even 3% of Germans have been vaccinated with both doses. And despite that, they've decided to open up, even though enough tests aren't available yet.
And virologists are warning that with infection numbers inching up again and new, more infectious variants spreading fast, the government's new opening strategy could prove very risky.
Let's pick up on some of those points with political correspondent Nina Haase. Welcome, Nina. Let's start with the lockdown strategy. Does the science support ending the lockdown in the way that the Chancellor has described, or is this more about politics and people's frustration?
Well, top virologists in this country have already come out as saying that they're warning that if it's not done carefully, we could run into the 3rd wave, which could potentially hit Germany very hard. And of course, from a medical virological viewpoint, it would be better to keep everything shut and not to have any contacts at all. So it's clear that Angela Merkel and the state leaders on Wednesday had to strike the balance between virological, economic and also social aspects. So yes, a lot of it has to do with people's frustration with how long this has gone on, but financial reserves are running dry, people are exhausted, and above all, the numbers have been rising despite this 3-month lockdown, so people are demanding different solutions.
So the solutions that were announced yesterday, what sort of difference is that going to make to day-to-day life for Germans?
Basically, we saw in this report that the new rules are very complicated, and the bottom line is you need to know just where your local area stands in terms of new infections. And depending on that figure, your regional government can then decide just which areas can reopen or which areas will also have to be shut again with that emergency break. So I've brought this chart with me. I couldn't resist because it is so German. We've got 5 steps here, and here in Berlin, for example, where we're below 100 new infections per 100,000 people in 1 week. And that means that our regional government can allow for museums to open from next week onwards with a clear hygiene concept. And then we need to wait 2 weeks and see whether the numbers are stable. And if they remain under 100, then Berlin can allow for outdoor dining if people bring a negative test result with them and so on. But it is very hard to understand, and the opposition is slamming the crisis management and the communication of the government as a total disaster. This chart, for example, is only available in German, no other languages.
OK. In good news, Germany's vaccination authority has approved the use of the AstraZeneca coronavirus vaccine in over 65s. So how much difference is that likely to make to what has been a very slow vaccine rollout?
It has been a very slow vaccine rollout. Jens Spahn, the health minister, is under tremendous pressure to keep his job. The opposition want him to resign. And of course, this news is very good news because it will hopefully help ease the supply constraints, which have also led to this slow vaccine rollout in this country. Because, of course, we're here in Germany, we're working with priority groups when it comes to vaccination. And the vast majority of people in the first priority group were the elderly, and they couldn't be vaccinated with AstraZeneca so far. That's now going to change. And so that is very good news.
Nina Haase, political correspondent, thank you so much. Here are some other developments in this pandemic. The EU's medicines regulator has begun a rolling review of Russia's Sputnik V vaccine, paving the way for its potential approval for use across the bloc. Sputnik has proven to be more than 90% effective in clinical trials. The World Health Organization is warning Europe to increase its vigilance for new highly infectious strains of coronavirus. COVID-19 infections across the EU rose by 1 million last week, ending 6 weeks of decline. And millions of vaccination shots from the free COVAX programme are due to arrive in Nigeria, Angola and the Democratic Republic of Congo. Last week, Ghana and the Ivory Coast received the first of the UN programme's batches.